Hello, everybody, and good morning. My name is Ricardo Cabrera, and I am the operations manager here at the Latino Chamber of Commerce of Boulder County. And today we have our special guest, Dr. Lizbeth Mendoza, and we are doing our bi-weekly COVID updates. Good morning, doctor. How are you today?
Hi, good morning. I'm good. How about you?
Excellent, thank you. Just getting back from a nice long Labor Day weekend and ready to start operations again.
Cool. Let's do it.
Let's do it. So before we get started, I just want to remind everybody that we have our new mandate from Boulder County Public Health that came to us September 3rd at 5 o'clock that tells and requests that we wear masks indoors everywhere we go. So we are going back, recurring to our masking, and then let's just add the washing of the hands and the social distancing so we can help ourselves and our community protect from COVID-19, which it is on the up and up. It's coming back, or I guess the cases are going up. And Doctor, why don't you tell us about stats and information since last time we spoke?
Yes, thank you. Yeah, just as you're saying, Ricardo, we are seeing an increase in the cases, just like we are seeing in the world, we're seeing in the country, and we're seeing it in our county. Compared to the last time that we talked about, that we were mentioning 53 cases per day as an average for 7 days. Now we have 77. So there is a clear increase. This we have seen since the end of June. And also, the other important number is the new cases, the accumulated new cases. And that number right now is 168 compared with 115 from 2 weeks ago. This is accumulated per 100,000 people. And this is an important number because this is how now we're kind of like measuring the level of concern that we should be having in the way that the CDC is using this dial of the community transmission, the transmissibility in the community. And right now with this number, we are at the top, the red state. So that means that we have a really, really, really high transmissibility rate of the disease. We're also seeing that there is an increase in the new number of new cases in 4 groups of age, being the most important those between 23 and 34 years old, and the kids 0 to 9 years old, those that cannot get vaccinated. Well, and then after that we have the 10 to 11. But yeah, we're seeing increases in this case, in these groups and in other couple groups. Other groups are kind of like stable. Now, per municipality, well, the distribution is kind of like a little bit of even, but we see most of the cases in Boulder and Longmont. We can say that slightly higher number or percentage of cases here. By race and ethnicity, we're still seeing that a more equitable distribution where we have 17% of the cases among the Latin Hispanic population, which represent the 14% of our population in Boulder County. This is a kind of like the good thing that is coming from all the efforts in equity, that we see that this is more fair distribution, whereas before, even when we were like 14% of Latins, the cases were like really, really high. The percentages were like way out, way too high compared. So this is a good thing of the work in equity. Now, when we look at the vaccines, that's also the good news, is that we saw a slight increase in the coverage, and we have now 82% of our population that is eligible has at least 1 dose, and 77% has the complete deal, the complete cycle, which means 2 doses or at least 1, or the one from Janssen. This is the goal, that we have our complete cycles, because that's when we know that we have all that 95% effectiveness that the vaccines give us. So yeah, let's if you forgot to get your 2nd dose, please go get it as soon as possible. If you already got your 1st dose, don't forget to show up for your 2nd. But we're doing good in that sense.
Excellent, excellent. Thank you. So just a quick summary. It looks like all the cases are going up. We are back to the weekly cases going up on the age groups, especially on the age group of 0 to 9. which is a conundrum. I mean, this is the group that cannot get vaccinated. So it is good to see that vaccinations in the population are going up, talking about 82% with at least one shot and 77 or 75% with a complete dose of 2 shots. You know, the rest of the people that have not gotten vaccinated are the ones that either cannot for health reasons or cannot because of age reasons. They don't have a vaccine yet for kids or choose not to do so. But tell me, you know, I guess one of the goals we have here is to invite people to get vaccinated. So if you can, really, this is one of the only ways we have to protect our kids, which cannot have a vaccine yet. There is not an approved vaccine for them yet. So the only way we have as a community to protect them is for ourselves to get vaccinated and to wear a mask. I think the public order is for everybody 2 years and up to be wearing a mask indoors. So the county also is trying to protect the little ones by at least using a mask, because that's the only way. Kind of like we were when this whole thing started. The only way to, you know, before there was a vaccine, all we could do is wear a mask. So with that, I'll invite you all to wear a mask. And of course, social distancing, washing your hands, because those are the only 2 things we can do, right? So with that, let me ask you, there's the question that I have is about vaccination. So I can get a vaccine, a full dose, which I have, and I'm pretty sure you do too. There is a booster. There's talk about a booster, and there's also talk about a 3rd vaccine. Can you tell us about that a little bit?
Yes, thank you for asking. This is a very, very hot topic right now. People are calling all the time to find out where can I get my booster vaccine. Not so fast. Let's explain the differences. So right now, what has been approved is what we call the additional dose or the 3rd dose. And that is only for people who have very like either moderate or severely immunocompromised systems. That means their immune system is not strong enough to even build a strong response to the vaccine or no response at all. So they really need the help of a 3rd dose, an additional dose. So this is what has been approved. The people who have any condition that put them in that group, you know who you are. I mean, because if you are severely immunocompromised, of course you have been treated for some reason, transplant or whatever. Then go get your 3rd dose, your additional dose. The thing is, only the people who received the Pfizer and Moderna are those that can receive this. These are the only vaccines that have been approved for 3rd dose, additional dose. Janssen has not yet. It's in the works, but has not been yet approved for a 3rd dose. The other important thing to consider is for you to get your additional dose, you need to have at least 28 days passed since your last or 2nd dose, because that means you already had your complete cycle of 1st, 2nd dose of Janssen Moderna. 28 days must have passed after that in order to receive your 3rd dose. So that's the case of the 3rd dose, additional dose. The other case is the booster, the one that applies to the rest of all mortals that want to get our extra vaccine. But that is not yet approved. That is still in the works. That is still into the research. Well, not the research, but the safety profiles are still being worked on, because safety is most important, right? So the safety profiles are still being worked on, and until then, the plan is to have everybody have accessible this booster by September 20th, around that time, 22nd. But this is still subject to approval. And the other condition is that at least 8 months must have passed since you received your complete cycle of vaccine of Pfizer and Moderna. So that means that even if you wanted to get your booster like right away, right now it's not approved, but let's say September 23rd, in case it gets approved, then still you need to have had passed at least 8 months since your last dose.
Wow. Okay. So that's good to know. So in generally speaking, neither the 3rd shot or the booster is available to the general population. The booster is not even approved by the FDA yet. And when it does get approved in the future, you're going to have to wait 8 months from the time you had your 1st shot to get your booster. So most of the population is out of that until the very, maybe even next year. And then the third shot, it's only for individuals that have a weak immune response system. So they have something additional that would warrant for their own safety a third shot. But for the general population, if you're already vaccinated, you're good to go, you're safe, you don't have to worry about any of this other than inviting your neighbors and your friends that are not vaccinated to get vaccinated. And this time really it's only and mostly, in my opinion, for the protection of the little ones, because they are in the gray area. There is no vaccine for them, and they are the ones whose cases are going up the fastest. Okay, excellent. Well, guys, all this information is out here. I have links for the websites where you can learn about COVID, you can learn about the variants, you can learn about where to go get vaccinated. In 2 weeks, on September 18th, the Latino Chamber, together with Dr. Lizbeth's group, we're putting together a vaccination clinic at the Roosevelt Park in Longmont from 11 to 4 p.m. We're going to have all 3 vaccines, the J&J, the Moderna, and the Pfizer. You don't need an appointment. You don't need any information or documentation. Just show up, go get vaccinated. I'm going to get a chance to meet you in person for the first time. Yes. And please go there and get vaccinated if you haven't done so. So is there anything else? Did I forget to say something, Liz?
No, I think you said it perfectly. Let's go get our vaccines, guys. We're doing great. Let's push it for the little ones.
Excellent. Thank you very much. And just remember, the one last reminder, the Boulder County Public Health mandated last week on September 3rd that we start wearing masks indoors for anybody 2 years and up. So let's do so. Bring your mask. Don't forget it. We have to get used to it again. I left the house the other day without a mask, and I'm like, oh, my mask. So I had to go back and pick it up. So.
Oh, yeah.
All righty. Well, thank you, everybody. And until next time.
Thank you. Bye-bye.